Hi, I'm Dr. Fry. I hope you enjoy your cataract surgery video which follows this presentation. Our surgery center is on Campus Drive, immediately south of the community college. Our eye surgery center is designed specifically for eye surgery, with everything from operating room design to state-of-the-art equipment optimized for the best eye surgery possible. The video you see here is the exact same view I have through the operating microscope. It is obtained with a 3-chip broadcast quality camera mounted on a beam splitter. I hope you enjoy your video and enjoy your new vision.
Today is Friday, and this is June the 22nd, 2012, and Dr. Luther Fry is ready to do cataract surgery on Richard's right eye. Now we're going to see a picture of the eye the way Dr. Fry sees it through the microscope. Now the reason the eye looks so red in the center is because it is reflecting off of the bright light of the microscope. Now this is a side port incision. This incision site is only about the size of a needle point, and Dr. Fry will be using this incision site for several instruments. First he's going to add some lidocaine to the inside of the eye. That's going to numb the inside of the eye. Now the outside of the eye has already been numbed, and this is just going to numb the inside of the eye. And next he's going to add some viscoelastic gel. Now this is a thick protective gel that'll protect the cells on the inside of the eye. Now there are cells on the inside of the eye that would not regenerate if they were damaged, so this will just protect the cells during the surgery. At the bottom of the screen is Dr. Fry's main incision. This is called a clear corneal incision. He's going to go up under the clear front portion of the eye and into the anterior chamber. Now Dr. Fry is going to be removing the lens of the eye today and replacing it with a new lens. So in order to do that, he first has to puncture the capsular bag, and then he's going to make a circular tear around the front portion of the capsular bag. Now the capsular bag is this thin membrane that surrounds the lens of the eye. So in order for Dr. Fry to get to the lens, he first has to remove just the front portion of the capsular bag. And he'll leave the sides and the back of the bag intact, and that's going to hold the new lens in place once he puts the new lens in. And then this portion of the lens that Dr. Fry is removing, this will not grow back, so there's no need to worry about it growing back over the new lens. Now this procedure is called hydrodissection, and Dr. Fry...
Teresa, you have a call on line 1. Teresa, line 1, please.
And Dr. Fry is using a saline solution that's going between the lens and the capsular bag, and this is going to loosen the lens from the bag. Now Dr. Fry will rotate the lens to verify he does have it loose from the bag. Now this instrument is called a phacoemulsifier. This instrument has an ultrasound and it vibrates and jars the lens, breaks it into smaller pieces, and then it vacuums the pieces away through the tip of the instrument. Now Dr. Fry is working his way down through the center of the lens, and when he gets to the point where he feels it's the weakest, he's going to go ahead and split this lens in half. Now this is the portion of the lens that Dr. Fry is removing is called the nucleus, and there are cells here that have been here since birth. Now when this lens started out at birth, it was soft and clear and smooth with just a few cells, and as time went on, new cells were formed and the older cells were pushed to the center. Now since all these cells were inside this capsular bag, they eventually became compacted and hard and discolored and hard to see through, and that's what's called the cataract. Now there's some of the oldest cells of the body are right here in this portion of the lens. Dr. Fry has split that lens in half, and he rotated the pieces, and he's going to go ahead and split them one more time. Once he gets them into the smaller pieces, he'll go ahead and roll these pieces over and vacuum, and we'll be able to see the thickness and the discoloration of the cataract. Now that Dr. Fry has that nucleus portion removed, this portion that's left here is called the cortex. Now this is some of the newer cells, and it's a little stickier substance, so Dr. Fry has changed instruments. He's using an instrument that's only 3/10 of a millimeter in diameter at the tip, and he's going to vacuum away the cortex by pulling it loose from the sides and the back of the capsular bag. He wants to get the inside of the bag completely cleaned out before he puts the new lens in. There's a little portion of the cortex that's still left, so Dr. Fry has changed instruments. He's using an instrument now that's called the anise cannula. This instrument that comes in from the side port incision has an angled tip, and Dr. Fry is able to reach around the sides of that capsular bag and go ahead and remove the rest of the cortex. The instrument at the bottom of the screen is replacing fluid back to the eye, and that way that eye maintains its shape at all times. Those two instruments that you just saw, Dr. Fry actually designed and developed those two instruments. This little instrument's called a squeegee, and Dr. Fry's just going to polish the back side of that capsular bag. He wants to make sure that he has all the cells and all the cortex removed, so he just goes ahead and goes across the back of the bag. Now this is some more of the viscoelastic gel, and Dr. Fry's adding this to the capsular bag, and it's going to expand the capsular bag, make it a little easier to insert the new lens. At the bottom of the screen is the insertion tube, and inside this tube is the new lens. As you watch it come up through the tube, you're going to see 2 tabs, a circular portion, and then 2 more tabs. Now Dr. Fry is going to position those tabs on the side of the capsular bag, just like that. Those tabs will hold that lens in place, and there's your new lens. Now Dr. Fry is going to go ahead and start removing that viscoelastic gel. That gel is thick enough that it could cause a blockage to the drainage of the inside of the eye. So he's going to remove as much of the gel as he can, and then this instrument is replacing fluid back to the eye at the same rate that the gel's being vacuumed away. That way that eye maintains its shape at all times. Now Dr. Fry is adding some antibiotics to the incision sites. That's going to heal those incisions. It's also going to seal those incisions. Now these incisions heal from the inside out, so there's no need for sutures. It does cause a temporary swelling of the cornea, but that actually helps seal down those incisions. That's the end of the surgery. It took 11 minutes and 21